Life is full of ups and downs, much like a roller coaster ride with its exhilarating peaks and sudden drops. But imagine living on a constant emotional roller coaster, where the highs are fleeting and the lows feel never-ending. Every high is quickly followed by a devastating low, leaving you feeling overwhelmed and emotionally drained. This is the reality for millions struggling with borderline personality disorder, or BPD, a condition that affects many aspects of their lives. BPD is a serious mental illness that deeply impacts how you feel about yourself and others, often leading to a troubled sense of identity. It leads to intense, unstable emotions, frequent relationship problems, and a distorted self-image that can be hard to manage. In this exploration of BPD, we'll delve into its complexities, aiming to provide a clearer understanding of this challenging disorder. We'll shed light on its symptoms, which can range from emotional instability to impulsive behaviors, and discuss the various causes, including genetic and environmental factors. Understanding BPD is crucial not only for those who live with it, but also for their loved ones, who play a vital role in their support system. Knowledge is power, and knowing more about BPD can help individuals seek the support and treatment they deserve, fostering a path towards healing and stability. Borderline personality disorder is a mental health condition characterized by a pervasive pattern of instability. This instability affects a person's moods, self-image, behavior, and relationships. People with BPD often experience intense and rapidly shifting emotions like anger, sadness, fear, and shame. These emotions can be overwhelming and difficult to manage. They often struggle with a deep-seated fear of abandonment, going to great lengths to avoid real or imagined separation from loved ones. BPD manifests differently in each individual. However, there are some common symptoms that define this complex disorder. These symptoms can significantly impact a person's ability to function in daily life, affecting work, school, relationships, and overall well-being. One of the hallmarks of BPD is emotional instability. People with BPD experience intense emotional swings that can last for hours or even days. They may feel happy one moment and then plunge into despair the next. This emotional roller coaster can be exhausting for the individual and those around them. A core symptom of BPD is a frantic fear of abandonment. This fear can be real or imagined. Individuals with BPD may misinterpret simple gestures or comments as signs that someone is leaving them. This fear can lead to desperate attempts to avoid abandonment, such as clinging behaviors, excessive reassurance seeking, or even threats of self-harm. This intense fear of abandonment often stems from early childhood experiences, such as neglect, abuse, or unstable family relationships. These early experiences can create a deep-seated belief that they are unlovable or unworthy of love and support. The chameleon effect. Unstable sense of self and identity disturbance. People with BPD often struggle with a shaky sense of self. They may feel lost and unsure of who they are at their core. This can lead to frequent changes in values, goals, interests, careers, and even friends. This unstable sense of self can also manifest as identity disturbance. Individuals with BPD may feel like they are different people at different times, depending on who they are with or the situation they are in. This lack of a solid sense of self can make it extremely challenging to build healthy and stable relationships. Reckless and risky, impulsivity in BPD. Impulsivity is another hallmark symptom of BPD. Individuals with this disorder may engage in risky and reckless behaviors without thinking of the consequences. These behaviors can include substance abuse, reckless driving, binge eating, unsafe sex, and excessive spending. This impulsivity often stems from a difficulty regulating emotions. When faced with intense emotions, individuals with BPD may act impulsively as a way to cope or escape from their feelings. However, these impulsive actions often lead to further problems and instability in their lives. The world through a different lens. BPD and dissociation. Dissociation is a common experience for individuals with BPD. It involves feeling disconnected from oneself, one's thoughts, feelings, memories, or surroundings. It can range from mild spacing out to severe detachment from reality. During times of stress, people with BPD may dissociate as a way to cope with overwhelming emotions or traumatic memories. While dissociation can provide temporary relief, it can also interfere with daily functioning and relationships. The root of the problem: causes and risk factors of BPD. The exact causes of borderline personality disorder, or BPD, are complex and not fully understood. This complexity arises from the interplay of various factors that contribute to the development of the disorder. However, research suggests that it is likely a combination of genetic predisposition and environmental factors. These factors do not act in isolation, but rather interact in ways that can increase the risk of developing BPD. Genetics plays a significant role in BPD. Studies have shown that certain genetic variations can make individuals more susceptible to developing the disorder. Studies show that people with a family history of BPD or other personality disorders are at an increased risk of developing the condition. This suggests that there may be inherited traits that contribute to the disorder. Brain structure and function may also contribute to BPD. Research indicates that abnormalities in certain areas of the brain, such as the amygdala and prefrontal cortex, may be involved in the emotional dysregulation seen in BPD. Environment also plays a significant role. The experiences and conditions one is exposed to during formative years can have a profound impact on mental health. Many individuals with BPD have experienced trauma or abuse in childhood, such as physical, emotional, or sexual abuse. These traumatic experiences can lead to long-lasting effects on emotional regulation and interpersonal relationships. Neglect, unstable family relationships, and parental mental health issues are also linked to an increased risk of developing BPD. Growing up in an environment where emotional needs are not met can contribute to the development of the disorder. Understanding these causes and risk factors is crucial for developing effective prevention and treatment strategies for BPD. Finding peace within the storm treatment options for BPD. While BPD can be challenging, it is treatable. With the right support and treatment, individuals with BPD can learn to manage their symptoms and build healthier, more fulfilling lives. Psychotherapy is the cornerstone of BPD treatment. Dialectical behavior therapy, or DBT, is a specific type of therapy that has been shown to be effective for BPD. DBT focuses on teaching skills to regulate emotions, tolerate distress, improve interpersonal relationships, and develop mindfulness. Seeking help and support. You are not alone. We will explore the importance of seeking help and the various support systems available for those dealing with borderline personality disorder. Borderline personality disorder is a complex and challenging disorder affecting many aspects of a person's life, including their relationships, emotions, and self-image. It can be overwhelming and isolating, but it is important to remember that you are not alone in this journey. There are numerous resources and communities dedicated to providing support and understanding for those affected by BPD. From online forums to local support groups, you can find a network of people who understand what you are going through. If you or someone you know is struggling with BPD, seeking professional help is crucial. Therapists, counselors, and psychologists are trained to help individuals manage their symptoms and develop coping strategies. Don't hesitate to reach out for professional assistance. Remember, the information shared here is for educational purposes only and should not be interpreted as medical advice. Always consult with a healthcare provider for personalized guidance and treatment options. If you are experiencing symptoms of BPD, please reach out to a qualified mental health professional for diagnosis and treatment. Early intervention can make a significant difference in managing the disorder and improving quality of life. And don't forget to like, subscribe, and share this video to help spread awareness about borderline personality disorder. By sharing this information, you can help others understand BPD better and encourage those in need to seek help. Together, we can break the stigma surrounding mental health and support those who need it most. Your actions can make a difference in someone's life, showing them that they are not alone and that help is available.